Hello, everyone. Welcome to Menopause Refined, the LifeSculpt approach. I'm Dr. Christi Prajudji Dawe, and I'm very excited to offer this masterclass on thriving through midlife. I am a board certified surgeon. I'm a certified menopause expert and a longevity enthusiast and aspiring expert. And my goal today is to educate, to inspire, and hopefully to give you hope about the future and your future decades that it can be amazing. So, welcome what to expect. So, welcome to a conversation created for you. Today is about clarity, not confusion, education, not dismissal, with real personalized solutions for women just like me and you who are navigating midlife changes. You'll gain insight into what's happening in your body, why your symptoms matter, and how LifeSculpt by Christi MD approaches menopause with intention, precision, and care, which is what you deserve. So, we're going to have some education. I'm going to go over what menopause is, the different hormones, and some of the solutions that I think are really amazing to help with menopause. And then we're going to have a live Q&A. So if you have any questions, please drop them in the chat, and my team will pass the questions along to me at the end of the Q&A. In addition, for those of you who are joining us live, taking time out of your busy day to listen into this masterclass, then we will have a special offer for you at the end. So, really looking forward to hearing from you. So, a little bit about me. So, I am, as I said, board certified physician, surgeon, urologist, and urogynecologist, and the founder of LifeSculpt by Christi MD. I am certified by the Menopause Society, and I specialize in hormone optimization, longevity medicine, and aesthetic care with a personalized patient-first approach. And I have an amazing team of nurse practitioners, physician assistants, and my associate physician, Dr. Nina Dureska, who are also equally committed to amazing medical menopause care and surgical care for patients, for women, and the men that they love. We also do treatment men for hormones. I'm currently the president of Houston Methodist West Hospital Medical Staff, the first woman president there, the winner of the Catherine Stream Award for Outstanding Contributions to Women's Health from the Greater Houston Women's Chamber of Commerce, and I'm one of the winners of the National Women's Choice Award. Menopause and longevity medicine matter personally to me because I'm just like you. I hit that wall and wasn't sure where to go. I went to my gynecologist for help and had to beg for hormones myself, and have also just been able to unlock some of the treatments that have helped me to age better, to continue with my mission in life, and to be a physician and to take care of my family. So, why LifeSculpt by Christi MD? Why would you want to come to our practice? Well, we are very focused on women in midlife, perimenopause, menopause, and beyond, because we see the problem, and we also see that there's a need for that in our community, that there is more to life beyond childbearing, and that's when we're really hitting our stride in life, when our kids are growing up and our career is clicking along. And unfortunately, our hormones aren't cooperating and we don't feel great, we don't feel strong and vibrant, and we want to fill that gap. And so we have been focused on this for a long time. We have over 30 years of experience in women's health and hormone medicine. We have built a great reputation in the community. We have consistent 5-star reviews. And so the reason why is because we really take the time to talk to you, to listen to you, and to understand where you are and discuss and help you figure out what's the best thing for you and then provide that care. And it's sort of concierge medicine, but without that concierge price tag. helping women feel confident, vibrant, and whole again. And we help support women from the inside out, addressing their hormones, their metabolism, their overall wellness. If they do need a surgical solution, we can help with that so that they can feel energized, confident, and fully themselves for the next chapter of their life in the coming decades. So that midlife wake-up call, what does that look like? Well, it's when you say that you don't feel like yourself anymore. I definitely hit that about the age of 49. I had been in menopause for 9 years. I went through very early, and I had been taking some hormones. They weren't really personalized. It was sort of just a prescription that was written for me. And I thought I was going to need to retire from my career, and none of us would be here right now if I hadn't have found the solutions that I found. And now I feel more like myself than I have in a long time. You feel tired, flat, or disconnected, where you don't feel like you can feel like yourself. You're not recognizing yourself physically or emotionally, and you feel invisible or dismissed during this stage. Those are some of the things that we hear from patients when they come in. They're often in tears and wondering where to go from here. But this can be an opportunity. And I actually wrote a book about this a couple of years ago called The BioVitality Blueprint, where sometimes that midlife wake-up call is an opportunity for us to really take a reset, to take a step back from our life and think about how we're living our life, and then to move forward with strength and stronger than ever before. So, how can you feel your best inside and out? We really believe in treating the symptoms from the inside out. And we are very big on looking at the lab numbers by seeing where exactly the patient's levels are, their micronutrients, but not just that. We have to look beyond the lab numbers because true wellness cannot be reduced to a lab report. Data matters, and it's very important to look at labs, and I think everyone deserves to have their labs checked. But what really matters also is how you feel in your body, and we listen to both here. We think you should be able to feel strong, confident, and energized. Feeling your best means that you have that energy to show up fully. You have strength to move through life with ease and the confidence that comes from being supported at every level of your health. And that's what we want to help everyone to accomplish that we can. We want you to love how you look and feel. That even no matter what your body type, no matter where you are in life, we want you to feel confident in yourself. And when your body is supported at a foundational level, when you're strong and you're feeling healthy and vibrant, feeling comfortable in your skin is just going to come naturally. It's that natural reflection of an internal balance and overall well-being. And we believe that how you care for yourself and how you feel is not vanity because it's in the purpose of helping you to be able to support your mission in life that God has created you for. It's an act of self-respect because you're worth it. Investing in your health means honoring your body, your confidence, and the life you are building in this next chapter without the pressure to look younger or be anything other than yourself. So, what are some of the common midlife symptoms that you may be experiencing? Well, fatigue and low motivation, brain fog, anxiety and mood changes, weight gain and stubborn metabolism, sleep disruption, low libido and intimacy, and loss of confidence in your body. Those are a lot of the symptoms that most women experience. There are some women that are very fortunate. They don't seem to experience these things, but I would say 95% of women do. And it is normal, but it doesn't need to be how do I want to say this? Just because it's normal doesn't mean that we have to live with it because we can age intentionally. We don't have to just sit back and say, well, I guess this is what it is. I'm just going to feel like this for the rest of my life, when there are very simple things that we can do to help you feel better. And sexual wellness, being a urologist and urogynecologist, I've been studying sexual wellness, intimate wellness, if you will, for my whole career. And of course, in urology, there's a huge focus on that for men. And that's mainly what I learned in residency. And then after residency, I did my own education on women's sexual wellness. And I believe that most women can have great sex at any age, but a lot of times we're held back because of pain, vaginal dryness, or we don't really have the libido to have sex. We don't feel good about ourselves. We don't feel comfortable. And I think we need to normalize those conversations about sex and pleasure. And women can enjoy fulfilling, confident intimacy at every stage of life. I see patients all the time that are in their 70s and 80s, even a 90-year-old before that was still having great sex. And it's also important for your relationship to continue to have great sex with your partner. It's fun and it's really good for your health too, because it helps with your blood pressure, your stress levels, your heart health. It's really good exercise. So let's talk about what's happening with hormones. What's really happening there? So during perimenopause and menopause, estrogen, progesterone, and testosterone begin to shift and decline, and it can often be dramatic, a sudden drop off. These changes impact your mood, metabolism, your sleep, your focus, and your desire. Symptoms feel widespread because hormones influence nearly every system in the body. And when they fall out of balance, everything feels off. So, menopause, perimenopause, is when the estrogen and the progesterone from the ovaries begins to decline. There are less eggs in the ovaries, there's less hormone production, and it becomes very irregular. And that can look like periods that are lighter than before, they can be heavier than before, they can be spread out, they can be closer together. And we start to see some of the symptoms of menopause. We see hot flashes, we see metabolism changes. And and then with testosterone, the levels decline slowly starting at age 30. So about 3% per year, the testosterone is going down. And that's a very important hormone for women. And we're going to go into that a little bit more later. And then finally, when we hit menopause, the average age is around 50, 52. That is when we stop having our period and we really have very little estrogen and progesterone left in our system. And we really start to notice these symptoms severely. And for some women, it can be actually debilitating and it can impact their work and their relationships, and can really be a negative impact on their life. So let's talk about the major female hormones. So these are 6 major hormones that can tip the scales for women. We've already touched on estrogen, progesterone, and testosterone. Also, cortisol is very important and it can get depleted with chronic stress. Thyroid is incredibly important. I think a lot of us have had our thyroid checked and are suboptimal, and that can affect our metabolism. And then DHEA is a less known hormone, but it's very important. It's from the adrenal gland and it's a precursor to testosterone and other hormones. And in and of itself, it's a very powerful anti-inflammatory and evening out hormone. And that one's actually available as a supplement over the counter. I do recommend medical grade if you want to supplement with DHEA. Your hormones affect you on a physical and emotional level. So you're not imagining it. You are experiencing some very real changes in your body and in your life. And I'm just going to do a quick time check here. Make sure I am on track. Okay, we are doing really, really well here. Good deal. Okay, so let's talk some more about the 3 major hormones that are declining. So Estrogen and progesterone are coming from the ovaries. So when you're in your normal cycle, the estrogen and progesterone are cycling with each month. So estrogen goes up, the egg pops out, and then the corpus luteum starts to make progesterone. And we get that cycle every month. And that gets really irregular during perimenopause. And then with menopause, it just goes straight down almost to nothing. And unfortunately, that is when we really begin to feel the symptoms. And let me back up for 1 second and just clarify, what are hormones even? What are they? Well, they are little chemicals that are floating around in our bodies, and there's dozens of them, all different systems controlling everything, the kidneys, the blood pressure, the brain, all over, everywhere. And they go to the cells of the body and they unlock the potential of that cell. So, a really good analogy would be to think about estrogen. What happened to your body when you were going through puberty? Okay, you're going through puberty, and all of a sudden your body grows to the age where you're starting to make estrogen and you begin to develop breasts, you develop the secondary sex characteristics such as hair in different places. So that estrogen went into those cells of the body and unlocked the potential of those cells. Well, that is still happening in all throughout our body. And when we don't get that unlocking, then those cells begin to decline. So we feel that. We feel that lack of energy. We feel that brain fog. And that is when we start to really be uncomfortable and not feel like ourselves. So estrogen and progesterone are coming from the ovaries. And if someone were to have their ovaries removed at a younger, before menopause, we call that surgical menopause, because those ovaries are now gone. And so they are immediately going to have a huge drop off in estrogen and progesterone. Estrogen is really important for bone health. So osteopenia, osteoporosis, very sensitive to estrogen. Cardiovascular health is improved with estrogen, and brain and mood function. Progesterone helps keep the hormones in balance. So estrogen is sort of like helps promote growth, and progesterone keeps it from being overstimulated, helps calm the sleep and nervous system support. So we usually do the progesterone capsules at bedtime so that you can sleep better. And they're, of course, very important for reproductive and uterine health. So if you still have your uterus after menopause and you're going to take estrogen, you have to take progesterone together, because the estrogen will just build up your lining, but the progesterone would be there to tamp it down. You don't want to start bleeding again. And that is something that can happen after menopause. Usually nothing to worry about. But if we can minimize that with the progesterone, that's better. Lately, more and more research is coming out that even if you don't have a uterus after menopause, you probably should still be on progesterone. It's still going to benefit you tremendously, and it's not going to harm you if you're using the natural form. And I'll go over that a little bit later. And then finally, the third major testosterone that we are focused on is testosterone. I mean, the third major hormone that we're focused on is testosterone. And women do not realize how important testosterone is to their health. A lot of doctors don't realize that because it's not something that is really studied or focused on in medical school or residency. But believe it or not, women actually have more testosterone floating around in our bodies than estrogen. It's just the ratios are different for men and women. So we have about a tenth of what men have. So men, they live around 1,000, 1,500 testosterone, and we are good around 100, 150. And that's not going to make us masculinized. That's not going to turn us into men at all, but it gives us that energy. It helps with our muscle mass, which is super important as we're aging. I like to call, well, I didn't come up with this. I heard this at a conference, but muscle is the number one anti-aging organ in your body. So that muscle is going to keep your metabolism strong. It's going to keep you functional and keep you mobile as you grow older. So testosterone is going to support that. It gives you energy, motivation, and mood. And it also helps with bone density among several other organ systems, including the brain. And I will say that when I hit that wall at 49 and I thought I was going to have to retire from medicine, which is my love, my passion, it was the testosterone that really turned me around. I already was on estrogen and progesterone, not really optimized, but the testosterone is what really got me back to myself and rocking and rolling along. And I intend to be on these for the rest of my life because I think they're so safe and so healthy. Okay, so let's talk about the Women's Health Initiative and what the science shows, because one of the biggest concerns that we hear from our patients is, are these safe? I heard that hormones cause cancer. This is going to cause breast cancer for me, And so let me just explain what happened, why that became the prevailing thought in medicine and in the culture and what we know now. So the Women's Health Initiative was misinterpreted and oversimplified. The risks were varied. The risks of the hormones varied based on the age at initiation, the type of hormone, and the route of delivery. And for many women, I mean, I would say almost all women, hormone therapy is safe, effective, and beneficial when properly prescribed. And there is nothing to fear about it. The truth about cancer risk is that it has not been shown to cause cancer. So just a little history lesson. Hormones, especially estrogen, were prescribed starting in the 50s, actually the 40s for some, and were widely prescribed for several decades, and were the second most prescribed medication by the 1990s. And almost every woman got put on hormones. And as an aside, hormone pellets have been around. We're going to talk about that in a minute, which is a special delivery system that I think is the gold standard for hormone care. Have been around since the 40s. So they've been around longer than the patch and the cream and all that. So we've got a lot of research on them and track record. So hormones were the most prescribed medicine by the 1990s. So then they said, well, you know what? We've got all these women on hormones. Let's study it. Let's see should we just do estrogen? Should we do estrogen and progesterone? Should we do which kind of estrogen and progesterone? So they did this big study and they saw one arm of it that had a slight increase in breast cancer cases. I mean, literally out of 1,000 patients in that arm, one extra person had breast cancer than they thought. So that got a lot of media coverage and it blew up. It was huge and it scared everybody. And so everybody stopped prescribing hormones. Well, shortly within that, within 5 years, the very authors of that study said, "Wait, hold up. We were wrong. It was just this one little branch, and it was the synthetic form of progesterone, the progestin, which was the link to that breast cancer risk. So the natural form of progesterone and none of the estrogen forms showed an increased risk of breast cancer. So I feel confident recommending it to my patients and taking it myself, because as long as we're not doing that progestin, there have been no studies that show that increased risk of breast cancer from estrogen and progesterone. And yet we have so many benefits that are seen in strength, libido, and even potentially reducing breast cancer risk. There are several studies that show that estrogen treatment helps prevent breast cancer risk. So in 2002, the Women's Health Initiative study changed how hormone therapy was viewed. And there was a lot of fear and confusion. Women and doctors as well were told that hormones were unsafe or simply not offered at all. Like, just don't even go there. I was part of that. I was also nervous about hormones and even like hormone cream for the vagina. We didn't want to use that because of this study. It was so impactful. But fortunately, we have moved beyond this false information. And now we have gotten to the point where even the FDA last year, I don't know if you saw this in the news, you can look it up, but they removed the black box warning on certain hormone therapies, reflecting a more accurate understanding of the risk. So whenever I would prescribe, let's say, vaginal estrogen to my patients for dry vaginas, they would come back with the insert and it would say, this has a black box warning about cancer and all these other risks. And now that is gone because the FDA recognizes that that is an unfounded fear and that we do not need to fear these hormones. The major medical organizations recognize that hormone therapy can be safe and beneficial for most women when it's appropriately prescribed, initiated at the right time, and personalized to the individual. And it's no longer seen as a single risk category. It's nuanced, it's patient specific, and it can not only relieve your symptoms and make you feel better and stronger and have a better life, your quality of life improves, your health improves, your long-term health is going to improve because if you're taking care of your heart and your brain, imagine the diseases that you are avoiding. Imagine how much more productive you're going to be and how much more you're going to be able to do with your life. So I'm very thankful that we live when we do now. Now we have these opportunities at our fingertips. So we believe in BHRT. What is that? It stands for bioidentical hormone replacement therapy. So we look at the root causes driving how you feel, and these hormones are structurally identical chemically to the hormones that your body is naturally producing. So they're designed to support your hormone levels as they change during perimenopause, menopause, and beyond. And they are prescribed based on individual hormone levels, how bad, how severe or less severe your symptoms are, and your life stage, and your overall health and medical history. So we take that all into consideration. What we do here is we do a 1 hour consultation where we can sit down with you and we can really get to know you, get to understand your health, and we can really talk to you about it and answer all your questions and allay your fears and help you feel comfortable with it. So the goal of BHRT is not necessarily to turn back the clock, although it is a secret to aging intentionally, is how I like to say it. Aging with intention. We're not just going to let this happen. We are going to take this bull by the horns. And it can restore balance, reduce disruptive symptoms, and support long-term health and quality of life. Some of the key characteristics of BHRT. So it's using hormones that match the body's natural chemistry. So remember I talked about how hormones are like a lock and a key. So if the hormone's the key going into the cell, the lock, then we want the more exact match that matches the normal is going to help your body to function better and function more normally. So that's why we want to have that exact chemical structure as much as possible to help the hormones to work optimally and unlock the potential of that cell. The other thing that we can do is we can customize the dosing rather than standardized prescriptions. So a lot of doctors, it's better than nothing. It's better than nothing. But a lot of doctors that prescribe hormones, they write for the patch, and the patch only comes in so many doses. And so it's not as easy to customize it for each patient. And they usually don't have enough time to really go through that and sit down with it. And a lot of doctors actually don't look at the lab values either. They just prescribe the patch. And that's, like I said, better than nothing. And I'm happy for that. But if we can do customized dosing, then it's going to be better for you. You're going to have better results. Everything is physician guided and monitored. I have a great team, as I mentioned, my PAs and nurse practitioners. We all work together. We have weekly conferences, case conferences, and we're evaluating you ongoing. We're monitoring your lab values. So if we make this change, if we give you this hormone, we want to see what it's doing in your bloodstream and what the levels are and correlate that with how you're feeling. We have some patients that do great at lower levels, some patients that do great at a higher level, but we have a target, like let's go for this target. This is a healthy target, and that's what we're going to aim for. And this is going to also help your not only feel better, but your longevity because your body's going to be thanking you and feeling better. So, hormone pellets. So, this is my preferred administration of BHRT or bioidentical hormone replacement therapy. There's creams. Some people aren't quite ready for pellets, and I totally get that and respect that. We all do. So there are bioidentical compound creams that you can get. And there's also the patch. The injections we're not as keen on, and I can explain that if anybody has a question about that. Um, but let's talk about hormone pellets, because to me, this is I would say the gold standard, and that's what I use. Okay. And I've been using them. I've been prescribing them for almost 10 years, and I've been using them myself for almost 8 years. Um, so what are they? So they are small rice-sized pellets, and I would say even this picture here is actually a little bit bigger than what they actually are. And we have pellets that are estradiol, and we have some that are testosterone, and we can really tailor the dose for what each patient needs. And they're compounded, so all that's contained in there is the hormone and then a little binder to hold it together, a natural substance that holds it together. And then it's going to slowly absorb into the system. And it's a pretty consistent absorption until it's gone. And so it's going to last about 3 months in women. And it's going to give very even levels of hormones, which is what I like. And in that you don't have to worry about taking a pill or doing a cream or anything else like that. So how do we insert the pellets? Well, it's a quick in-office procedure. And because, of course, we're originally and still are a surgical practice, we're using surgical technique. We are being very using sterile technique to prevent any complications, infection. And we know how to do this very comfortably so that you don't have to worry about it's going to hurt. The worst part is just getting the local anesthetic injection, that little sting when you get the local injected. But other than that, it's a piece of cake. So we numb the area and we insert it either in the upper buttock, in the fat layer, or in the little love handle. So we recently started doing the love handle insertion, and I actually prefer that for myself. It's very easy. It feels easier to recover from. And so I think that's something really to consider. So we make a little tiny nick in the skin, literally like that big. And then we just have a little pusher to insert the pellet inside. We don't have to put a stitch. We put a little steri strip, a little bandage, and then you can return to normal activity in 24 to 48 hours. If you do some heavy exercise, you want to take it easy on that for 3 or 4 days. And then the pellets will last 3 to 4 months, depending on the individual needs. And we monitor the blood work. So some people metabolize more quickly than others. Some people, their body just processes through it more quickly, so they might need pellets a little quicker. So that's why we're going to monitor the blood work and see where you are until we hit that steady state. They're going to release the hormones slowly and steadily over time and mimic the body's natural hormone rhythms. And like I said, you can avoid the daily dosing. It's a lot easier to manage, a lot more precise, and it can help reduce hormonal highs and lows. So it's going to be a very even process. And some of the benefits can include improved energy and mood, better sleep, better libido, support for your metabolism and your muscle tone, and improved mental clarity. One of the things that I would be remiss if I didn't say is that you can't take them out. So they do have to absorb over time. So what we do here is we are going to err on the lower side of dosing to start. And then we can always add more if we want. Um, it's rare, very, very rare that we have a patient that has a negative side effect to the pellets. We really don't see that. Some of the some of the things that we've seen in the past is some people are more sensitive to acne or to hair growth, and then we need to adjust the dosing. But if they just, wait it out, then we can adjust that on the next dose. But that's very, very rare with the way that we dose here. So, is pellet therapy right for you? Well, it's best for patients who want consistent hormone levels. You prefer a low maintenance option. You've tried other forms of HRT and you still have symptoms that are not well controlled. And you want quick relief because you're going to get relief from the pellets usually within a couple weeks because your body's going to all of a sudden get flooded with these hormones and is going to be really, really happy. This is always going to be guided by lab testing, symptoms, and individualized care. So what is the interplay between hormones, aging, and longevity? So hormones are part of the foundation for healthy aging. They have an impact on bone, heart, brain, and muscle. And longevity is about quality of life, not just lifespan. So there's a new term out there called health span. So, our goal, my goal, and what I think is a good goal for most people is to live as long as possible, but staying healthy and active and independent and functional and being able to live out our mission as long as possible. We want to feel good now and we want to protect our future health. And that's where I think hormones are very foundational. I went to a longevity conference and listened to the talks for 3 days. And at the bottom line, the foundation of health is, drum roll please, diet and exercise, of course, these lifestyle things, staying healthy, staying active, being functional. And then the next level right after that is hormones. That's how foundational they are because they are so impactful to your health. Why don't women get the help they need? Did you know that in the United States, less than 5% of women are on hormone replacement therapy? Well, the reason is because the symptoms are treated in isolation. They go into the doctor for, this symptom or that symptom, and then they're given an antidepressant. They're given, a pain medication instead of looking at the whole picture. And oftentimes, I had a patient the other day tell me, actually, she's a doctor, and she told me that she was told this is just normal aging, that her doctor said, you're fine. This is just normal. And I will say that, her doctor was not quite menopause age. So, it kind of changes when you go through it yourself and you realize like this is not fun. Like do I have to live like this? No, you don't. Lack of personalized hormone care. So not having that
Возможно,
precision of hormone care. And women are left
Потяпу.
frustrated and unheard. So they go in and they talk to their doctor and they are given the message that, you are, that you don't need to worry about that, and they don't get the answers that they need. So our philosophy here, which we've kind of gone through already, is a personalized root cause approach, looking beyond the symptoms to understand what's driving how you feel. We treat the whole woman, the whole person, the hormones, the energy. We look at your micronutrients. We can see where you need to focus, what you need to focus on to really get as strong and healthy as possible. We integrate the hormones, metabolism, and lifestyle, and we help women feel like themselves again, but better. And we have a longevity program. We have an annual plan that we offer here that includes that comprehensive hormone evaluation, customized treatment plans, ongoing support and optimization, and can focus on sustainable results and long-term vitality. Longevity medicine is really growing. There is a huge interest in it because we can see that waiting for things to break and then trying to fix it is not as effective as preventing things from breaking. So if we can prevent things from breaking by being as healthy as possible, supporting our body, then we're going to avoid a lot of those issues of aging, and we're going to be stronger, healthier in our later decades, and we're going to enjoy life a whole lot more. We also are very focused on intimate wellness, and we have lots of intimate wellness options. We can help with dry vagina, painful intercourse, lack of orgasm. Of course, the hormones help with libido to get that sex drive back. We can look at all of that and help you to really optimize your sex life and enjoy that part of your marriage to the fullest. And we have some real patient stories here. So this is Jen, and she said, if you're in perimenopause or menopause, I highly recommend this med spa. In 1 year, I have done a complete 180, and I couldn't have done it without these ladies. I received a full panel blood work, BHRT, customized supplements, and a meal plan. I feel like a completely different person. The staff is attentive, knowledgeable, and so friendly, ready to feel like yourself again. Contact LifeSculpt, you won't regret it. She like did a little commercial for us. We didn't even we didn't solicit this. She just voluntarily gave us that review. It's so nice. We have so many of these. If you go to our Google page on the map, Google Map, you'll see all these reviews. We have 5-star reviews. PA Kim is amazing. This is a real patient. She put her own picture on her Google review. My friend recommended her to me because I had been dealing with severe symptoms from menopause for the past 2 years, and I tried everything you can name to help, but nothing worked. So I decided to try the bioidentical hormone pellet treatment. And it has been the best decision I've made. Kim is caring. She makes sure to take care of her patient during and after treatments, ensuring that the treatment is working for them. I would highly recommend Kim to all of my friends. Thank you so much for helping me to get this menopause under control. So you deserve this. You deserve to put yourself back on the priority list. You have taken care of your family, you've built your career, you've done it all. And now it's time for you to take care of yourself, and you continue to do it all for everybody else. That's the way it works, right? I want you to release the guilt around self-care, that you're not being selfish. You are taking care of the body that God gave you. You are feeding your body what it needs. You need to feed it good food. You need to feed it sunshine and exercise. And I think you need to feed it hormones. I can tell you from my personal experience, it's powerful. And menopause can be a powerful transition that you can use this to launch you into the next phase of just your amazing life. Confidence, energy, intimacy, and joy are possible. And living proof, I see it every day in my patients and in my colleagues that are on the pellets as well, or on hormone therapy. If you're not ready for pellets, don't worry. We're not going to push you into it. We're going to tiptoe you into it, and you'll do the creams. Some of our patients are on creams and they're happy, and that's great. So what's next? How to take the next step? We've got consultation and program options. We can get you started with a consultation. We've got a special offer for you for participating today. And you can come in and you can expect that you're going to get excellent care. You're going to be heard, and we're going to look at deeper causes, and we're going to help you to feel better. We're going to do everything we can to help you feel better. We leave no stone unturned. So I really appreciate everyone that participated today. I'm going to take some questions. We're not doing verbal questions. It'll be too confusing. So drop your questions in the chat. And then actually Kim is here, and Katie, my PAs, and Christine. Some of them you see in the picture here. You also see here my wonderful husband, Scott. He's the COO of the practice, and Victoria and Maggie. This is just part of this amazing team, and we are on a mission to help women, and we want to help you. So if you have any questions, let me know. You can contact us at 713-979-LIFE, but we really want you to email us, connect@lifesculptmd.com. And we're going to take some questions. And before I do that, I want to tell you that if you are new to us, then it is time to schedule your consultation. So for new clients, new patients, we want to offer you a comprehensive physician-directed visit conducted by one of my advanced practice providers that have been trained under my clinical approach and are all have pending menopause certification. The test will be coming up in a few months, so they are all preparing for that. And during this consultation, we're going to review your symptoms, discuss appropriate lab testing, and outline a personalized plan. So the consultation fee with them is normally $200. I do have some consultation spots for myself. They're going to be more expensive. And as a thank you for attending today, we're offering the consultation with one of my PAs or nurse practitioners for $100 instead of $200. And if you come in, you do the consultation, and then you want to move forward, then your initial consultation fee will be applied to that treatment. So basically, you'll get the consultation for free. And we have set aside appointments at both locations, our Katy location and our Galleria location, for masterclass attendees. So to get this bonus offer, contact us. You can call us at the number there or email us by Sunday at 1 p.m. Your visit may take place at a later date, obviously, but we need to get you signed up ASAP for you to take advantage of this. And before we close and before we get to the questions, I have two final items. So if you book your next appointment by Sunday, we will set aside a Derive daily hair support serum, $120 value for you to pick up at your visit. And this will be available to new clients and our loyal clients. So one of the most common things that we see in midlife is hair loss. And so this Derive hair serum is going to really help to thicken up your hair. And then finally, one of you will receive a $250 LifeSculpt gift card, which can be applied to anything that we offer here, including facials and hormones. So to enter the drawing, simply email connect@lifesculptmd.com with your full name and your best phone number so our team can verify your attendance. No appointment is required to enter. And all entries must be received no later than Sunday at 1 and we'll contact you directly. So thank you for spending this time with me, with us. We're so grateful. And now my team, we've got about 10 minutes, 8 minutes. We're going to take some questions. And do you have, are these the questions? Okay, so they wrote down some questions that are coming from the chat. So when is the ideal time to consider hormone replacement? So the ideal time is going to be whenever you start to notice these symptoms of hormonal changes. So it could be, we have some patients in their 20s and 30s even that are already needing to have some hormonal support because their hormones are so out of whack. And we can check your hormone levels and see what you need. Now, there is some talk online and in the medical community about once you get past 60, 65, can you start hormones if you've never replaced them at that age, if at 60, 65? And the concern is heart risk. The recent data shows that we do not need to worry about that. If you have a healthy heart, if you're active, you've had your heart checked, then you can still start hormones even when you're older. And we do that all the time here. We help patients feel great no matter what decade they're in. We actually have a couple in their 80s that are both on the pellet therapy, and it's been just a game changer for them. Okay, so how do I know if I'm a good candidate for pellets? Can I manage this naturally? There are some um, there are some different supplements that can help relieve the symptoms of menopause to help decrease those hot flashes, help your brain health. And that's definitely something that can be considered. And we can actually do micronutrient testing and see which particular nutrients and antioxidants are most effective for you. And then we can replace those very targeted. It's not going to be the same as hormones. It's just not. I mean, the hormones are going to like they're that key. They are going to unlock the potential. So they can be helpful if you really don't want to do hormones or for some reason you just absolutely cannot. But the hormones are going to be the way to go more than supplements. And how to know if I'm a good candidate for pellets? Well, you come and talk to us and we'll talk about your symptoms. We'll let you know. We'll look at your blood work and we can let you know if this is going to be a good option for you or not. And like I said, yes, we love pellets. We think they're number one, but if you want to do creams, we are all for it. And we do that all day long. Patches, we've got all kinds of solutions that we can do for you. Um, what changes can I expect if I do pellets? How long does it take? Most of our patients notice improvement within a week or two. They start to feel better almost immediately from the pellets because their body is suddenly getting this infusion of energy, unlocked potential. Those hormones go in and they excite that energy production, that Krebs cycle in each cell that is really producing the energy from the food that we eat. It's making the cells get more activated. The blood flow is flowing to the brain and everything's functioning. Libido starts to increase, when is so many women come in and they say, I forgot what it felt like to want to have sex and now I want to have sex again. And how long does it take? 1 to 2 weeks. We said that. Okay, I have friends who use creams and patches. How do you decide the best option for me? We're going to talk to you. We're going to listen to you. We're going to decide this together. We're going to go over the options. We're going to talk about your goals and where you want to be. We're going to talk about your activity level and what your comfort level is. And then we're going to prescribe exactly what you need. So this is going to be shared decision making. We're going to do this together and we're going to help you hold your hand throughout the whole process so that you never feel like you're alone, like you're trying to figure this out on your own. That's what we're here for. How long does the pellet procedure take? Well, it takes about 10 minutes. So we're going to bring you in, talk about how you're doing, see if we need to adjust the dosing, and then we have a whole box full of different doses of pellets, and we can pick out exactly what we need for that patient for you. So if we need to go up from your last dose, if we need to decrease it, we can do that. Sometimes we just do estrogen, sometimes we just do testosterone. We usually do both. And we're going to precisely determine what you need and talk to you about that. And then the procedure itself will take about 10 minutes. You can go back to work, go back to your normal activity, but being careful about exercise. The pellets sound great. Do you also treat men? We do. Yes, we do. Yes, we are focused on women, primarily in midlife, but we treat some younger and older, of course. But we also treat the men that you love because this is so important. And there's also a gap for men. A lot of men go to these tea clinics now. They've popped up everywhere and they have a purpose, yes. And they're mainly selling or prescribing testosterone injections, which can be helpful for some people, but and I prescribed them years ago when I used to do straight urology and saw men and women. Um, but what I saw with testosterone injections is that they would see big peaks and valleys. So they would inject once or twice a week. It's very laborious. It's hard to travel with the injections. And they would come at the end of the week or the 2 weeks, they would just be desperate for their hormones. It's not even, it's not smooth. And so men really benefit from pellets too. They're, of course, going to do a much bigger dose than women, 10 times the dose. But we do treat them. We love our male patients. We also help them with erectile dysfunction and their aesthetic needs too. More and more men are interested in skincare, so we can treat them as well. Okay, last question. Um, oh, we already went over that. Can you have too much hormones? If so, what can happen? Um, you can have too much hormones. Yes, you can. And you don't feel good. You don't feel right. You feel either your mood changes. You can have secondary effects. We talked about acne and hair growth. I mean, think about, people that take hormones to try to change their gender, that Yes, that can happen. It's not going to happen with us. We're going to dose you properly. We're going to make sure that you're at a healthy level and that you are going to experience the full benefits of the hormones. So I just want to say thank you again so much for joining us. And I hope this has been educational, inspiring, that it's given you hope, that you have a better understanding about your body and about what is available. And so with that, I'm going to conclude this webinar. Please don't forget to email us at connect@lifesculptmd.com right now so that you can be entered to win in our drawing for $250 complimentary for whatever service you want. And then if you would like to make that appointment or get your hair complimentary hair serum, also email us and let us know about that. We look forward to hearing from you and meeting you. And I just wish you all the best. God bless you.